Today's VETgirl podcast is brought to you by Elanco, makers of Zenrelia, a lunocitinib tablets. Get dogs back to normal with the new once-daily JAK inhibitor for dogs over 12 months of age with allergic dermatitis and atopic dermatitis. For more information, visit my.elanco.com/US/Zenrelia. Read the entire package insert before using this drug, including the boxed warning. For full prescribing information, call 1-888-545-5973 or visit www.elancolabels.com/US/Zenrelia. Hi, VETgirl here today and super excited to talk about all things derm. You guys have heard me say this a zillion times. I am a derm idiot. And if I could repeat vet school, I would have paid attention in dermatology and cardiology more. But enough about that. Super excited to have Dr. Ashley Bourgeois, who's a board-certified veterinary dermatologist. You guys probably know her as the Derm Vet. Join us today to talk about all things allergies. Ashley, thank you so much for joining us today.
Thank you so much for having me. I'm always excited to talk about derm if it makes you feel better. I'm pretty much a dummy in anything not derm, so you've got me beat.
I love it. I love it. All right. So just so our VETgirl audience knows a little bit more about you, do you mind giving us a little bit of background about who you are, where you trained, and what you do now?
Definitely. So I am a board certified veterinary dermatologist currently in Portland, Oregon. I did my undergrad at Iowa State, did my veterinary degree at the University of Missouri, and then did my internship at Purdue. So I like to say I toured the Midwest. And then I did my training with a private practice animal dermatology clinic in Orange County, California, which is the company I'm still with now, practicing in the Pacific Northwest.
Wonderful. Thank you so much for joining us today. Love what you do. And again, I think what I realized over time is you just can't know it all, right? So it's good to be able to get a lifeline from a fellow board certified specialist in an area. So let's talk about all things dermatology. Now, I will say, since I have a pit bull mix and I also have a bulldog mix, I personally deal with allergies in my own pets. Now, what are the biggest challenges in managing allergies in dogs for your general practitioner?
Oh, so many, but I would say the two that really come to mind. One is really educating them on the chronicity. The unfortunate but fortunate thing about derm is that we are often dealing with allergies, a lifelong disease. So it's fortunate because I really get to know my clients well, and that's why I love my specialty. It's unfortunate because when owners come in for a cure, I don't have it for them. This is something we have to manage long term, and that can be really difficult. I'd say the second thing is the fact that every patient is very individual. So we have certain medications, we have topicals, we have preventatives, diets, they're all wonderful, but every biology is crazy, right? So everyone reacts to things differently. So there's no magic medication that treats all of them. We have to have lots of different options, and sometimes we have to try multiple things to get it right. And so it's really important for us to recognize that there is a reason that so many therapies exist, and that's because atopic dermatitis is actually quite a complicated disease.
All right. Well, the good thing is when I went to vet school 30 years ago, yes, it was that long. We didn't have much for choice. We had some type of antihistamine, whatever your favorite type was, and the good old drug, prednisone or prednisolone. And there's so many options now. So, how do you decide whether to treat a dog with Cytopoint, a JAK inhibitor, steroids, cyclosporin, or other prescription medications?
Yeah, and I will say when I first started practicing even, and I'm slightly younger than you, but I'm starting to feel a little bit older. When I came out, it was cyclosporin, steroids, antihistamines. So we have gained so much more options, the last decade, which has been really wonderful. There's a lot of things that really feed into which one I decide to start with. The things we have to think about with allergies are one, what degree of itch do they have? And anytime I'm dealing with an itchy pet, I have to make sure infections, ectoparasites, those simple things are managed. But then two, it is what are our long-term goals that we're trying to achieve with that patient? So when I'm just looking at symptomatic treatment, if I am just looking at, hey, let's reduce itch quickly, I am going to try to use something like a monoclonal antibody or a JAK-STAT inhibitor because of the side effects that don't come with them, such as steroids cause PUPD, a lot of other issues. We don't tend to see those side effects from something like a JAK-STAT or a monoclonal antibody, but they provide quick itch relief. Now, if I have something like a really itchy pet that has a ton of swelling, so think about as a, especially in something like an ER situation, those really bad edematous stenotic ears. If I have a patient comes in, they're very itchy, but their ears are so swollen, I can barely get a scope down them. I probably am reaching for something like a steroid because I need that really broad spectrum anti-inflammatory property to it. When I reach for something like cyclosporin is when I really need to control something like that broad inflammation. But maybe I'm looking for more of that long-term effect, right? Because steroids are fast, cyclosporin's not that fast. So cyclosporin's a great option in my really chronic interdigital furuncle dogs that no matter what I do, they're draining and having these lesions all over their paws. But for short-term relief, I'm usually using something like a steroid. So I think that's really important for veterinarians to recognize is there are lots of different ways that allergies present themselves, and we do have to look at the patient and say, how much itch control do you need? How much inflammation control do you need? What other signs are you showing me, like ear disease, furuncles on the paws, things like that?
Great information. Thank you so much. Now, should general practitioners carry more than one JAK inhibitor now that there's a second one available?
A resounding yes. A resounding yes. I think what's really difficult in is what we hear from veterinarians when new medications come out is that people really want just one option, right? They're like, well, but which one, this or that? And to me, I can tell you a case that has been successful or has failed every medication I have, including steroids. I have patients who fail steroids for their itch control. This is a very complicated disease, as I mentioned before. There's itch, there's inflammation, there's skin barrier, there's microbiome. They have different, pathogenicities they show us. And so there's no one medication that's going to control every patient. And I know for me, if I was seeing a dermatologist and I didn't respond to something and they just said, sorry, that's the only one I carry, I'd be heavily disappointed if there were other options, especially if they were commercially available. So we really want to recognize that no matter what, I've had patients who have responded or failed to all of these medications, and we need those options. There are numerous JAK-STAT inhibitors in human medicine. It's taken us a long time just to have two in veterinary medicine. So we always want to make sure we can provide relief, especially with atopic dermatitis in dogs being one of the most common diseases that a general practitioner is going to manage.
And for those of you guys who don't know, Elanco recently released ilunocitinib, which is Zenrelia, and that recently came out. So that's one of the reasons why we're talking about that. Now, what has been your clinical experience so far with Zenrelia?
Yeah, so I have used Zenrelia for about a month now. Originally, when it got released, Oregon was one of the few states that there was a delay for a few weeks before we had it available to us. So I actually have had some rechecks, which has been great just to see the response. And I have had success with it. I have had cases that we have not responded to all the other therapies that we had. I had a little terrier mix recently that we were kind of living with an itch level of 6 out of 10 because despite everything that I had available to me, we weren't able to control that patient. And now he came in and he was a 3 out of 10, which, we still have a little bit of work to do, but was the best we'd have ever seen him respond. So we definitely have had success with it. There are, of course, going to be patients that don't respond to it because no medication is going to have a 100% success rate in managing itch in an allergic dog. But we have had patients where it's been wonderful to have another option that's easy to give, that they've tolerated well, that we can provide that relief. The thing we have to realize about allergies is it's not just the pet that's suffering, it's the owner. So, you have allergic pit bulls. I have an allergic pit bull. I'm a dermatologist. I get frustrated when she's licking and chewing and scratching. And this is what I do with my life. We have to realize that this is a quality of life issue for owners and pets. So to be able to have another option that's been more successful in some of my patients has just been wonderful.
I'm so glad you brought that up because I will say, as a bitter, cynical emergency critical care doctor, I'm not always that empathetic. And I became so much more empathetic why pet owners bring in their dog at 2 a.m. into the ER for a hotspot or for licking. And I didn't realize that until my pit bull was doing this in the middle of the night. And I was like, oh my God, I can't take that noise. And then even when I put a rubber band around the dog tag so I couldn't hear the like neck scratching and the jingling, it was the that drove me nuts. So it really made me empathetic on why pet owners really view pruritus so much differently than we do, right? At the same time, I've also had the reverse cases where a dog will come in with a septic peritonitis. I'm doing a post-op evaluation on the patient. It just went to surgery. And, the next day the dog's doing better and the technicians are mocking me and laughing at me because I'm flushing out the ears. And it's because there's purulent, disgusting discharge coming out of the ear. And I'm not sure if the owners didn't notice it or they didn't notice the smell. But I'm going to say it probably goes both ways, and you probably see that too. But again, always helps when we're empathetic towards what a pet owner is going through, what the pet's going through too. Now, I did want to ask, how are you communicating with your clients about the boxed warning on the label for Zenrelia? And in general, do you have any hints when communicating with clients about the use of JAKs inhibitors?
Yes. So one thing we do have to realize about Zenrelia, and I love client communication. So I am very upfront and honest and open with my clients about any medication I'm going to put them on. That there is a black box warning, and that is regarding response to vaccines. And this particular warning was based off of a study that was done with a small population of 8 dogs that essentially were unknowingly ill when the study started and were underage and given 3 times the dose. Now, for safety studies, they're expected to do a study that would have underage dogs that would get an elevated dose. But what they saw was some of the dogs did not mount an appropriate vaccine response. There has since been presentations of larger studies of dogs that are of age getting the appropriate dose that have a normal vaccine response. So, what I always tell owners is here's the reason that is there. It is a newer medication, so we're going to start it. I particularly, if they're on label dose, especially most of the time, I am seeing cases as a dermatologist that are usually like 3, 4, 5 years of age, right? Because they've kind of managed that disease with their vet for a while and then they come to see me. So if they've been appropriately vaccinated in the past, getting the appropriate dosing of age based on some of the newer literature that we have, I haven't been overly concerned about it. But that being said, as we continue to monitor the medication, it's something I want to be upfront and let owners know why it is there. This is what is there. I'm going to be upfront. I don't get vaccinations, right, as a dermatologist. So I'm always going to be respectful of what my general veterinarians want to do. If vaccine comes and we need to figure out alternatives like a monoclonal antibody or control their disease around their vaccine time, I'm going to be okay with that. But me personally, with them being on label dosing, being a pet who's previously received vaccines, don't have large concerns about it. So I let owners know it's there. I think we do need, it's our responsibility to let owners know it's there. I let them know why it's there based on what study and how that study was done. And then we have a discussion about it. And honestly, most of my owners have been fine with it, especially because in my hands, it has been cases that have not responded to things. So they want to try to provide relief for their pet.
In full disclosure, Ashley, I don't vaccinate in the ER either. In fact, the clinic I used to be at, we didn't even carry vaccines. One, we didn't want to upset the referring community. The only vaccine we truly carried was the rabies vaccine for a pet that came with a random wound. But knowing that both of us as board certified specialists have no idea about vaccines, I'm going to always say, when in doubt, you want to check with the Elanco rep. They're going to have the best technical information about it. The last person you want to ask is a criticalist when it comes to vaccination.
Yeah, that's fair. And things are always changing, right? There's more literature that comes out, there's more information that comes out. So I totally agree in those situations, especially if my referral population's asking me, like, hey, I have one of your patients, vaccines are coming up. I think it's always great to get the most updated information from the company itself.
Awesome. And one last question I did want to ask because I don't know that much about it. Is Zenrelia once a day?
Yes, so that is one of the benefits of Zenrelia. There's a dosing chart that's provided by the company. It is dosed at zero point 0.6 to zero point 0.8 mg per kg once a day. So there's no induction dose. It's always once a day, right when you start it and when they continue it long term.
All right, Ashley, I actually have one more question. What actually is the difference between Apoquel and Zenrelia?
Yeah, I think that's a great question because we call them both JAK-STAT inhibitors, but they are different. So, Apoquel, primarily what we need to know about JAK-STAT inhibitors is there's actually a few different receptors that are within that class. So, Apoquel is primarily a JAK1 and then some JAK3. Zenrelia is JAK1, but then JAK2, and then a molecule called TYK, TYK, TYK2. So, there are some differences. Zenrelia is a bit more non-specific. So there are different ways that they work. And again, I will tell you, since having this medication, I've had success, not as much of a response as I'd hoped for any of these medications. The body is a difficult thing to really predict. So having the availability of both of these, it's important to recognize that their mechanism of action is different.
Awesome. Thank you so much, Ashley. Always love chatting with you. We should do more podcasts on work-life balance and like how to handle being a working mom. Seriously, the struggle is real for all of you guys out there.
The struggle is real. We had discussions before even hopping on about, the life as a working parent in the veterinary industry. But I guess the most important thing to know is all of us feel it, but always up for that conversation as always.
Awesome. Well, once again, thank you so much for all that you do. Always love chatting with you and really appreciate you taking the time today to be on today's VETgirl podcast.
Thank you. I appreciate that.
Indications. Zenrelia is indicated for control of pruritus associated with allergic dermatitis and control of atopic dermatitis in dogs at least 12 months of age. Important safety information. Read the entire package insert before using this drug, including the boxed warning. For full prescribing information, call 1-888-545-5973 or visit elencolabels.com/US/Zenrelia. Warning: vaccine-induced disease and inadequate immune response to vaccines. Based on results of the vaccine response study, dogs receiving Zenrelia are at risk of fatal vaccine-induced disease and inadequate immune response to vaccines. Discontinue Zenrelia for at least 28 days to 3 months prior to vaccination and withhold Zenrelia for at least 28 days after vaccination. Dogs should be up to date on vaccinations prior to starting Zenrelia. Do not use in dogs less than 12 months old or dogs with a serious infection. Monitor dogs for infections because Zenrelia may increase susceptibility to opportunistic infections. Neoplastic conditions, benign and malignant, were observed during clinical studies. Consider the risks and benefits of treatment in dogs with a history of reoccurrence of these conditions. The most common adverse reactions were vomiting, diarrhea, and lethargy. Zenrelia has not been evaluated in breeding, pregnant, or lactating dogs, and concurrent use with glucocorticoids, cyclosporin, or other systemic immunosuppressive agents has not been tested. For full prescribing information, see package insert.